Check out this root canal, tooth number 15. This root canal was done by the patient's previous dentist 3 months ago. And patient kept going back to the dentist and complaining about the tooth being sore and achy. And the dentist says that the reason for that is because the tooth needs to be crowned. The same dentist who did the root canal. But take a look here. One different angulation of the tooth, and you can see that this dentist missed the MB root completely, and very likely MB1 and MB2 canals. So there he goes. Missed canals here. And you can see it here. So you can't do work like this and expect success. Now, I've had cases where I've done a root canal on a patient and the patient comes back a few days later. I know that I have not missed the canal. I know that I've got everything. Yet patient comes back to me and says the tooth is sensitive to cold. Doesn't say the tooth is sensitive to heat. Patient says the tooth that we did a root canal on is sensitive to cold. What do I do in cases such as that one? I always believe the patient, of course. I never try to dismiss a patient. I always believe a patient. Let's say during treatment, if patient raises his or her hand and indicates to me that they're feeling what I'm doing, I believe them. I don't say, it's impossible. You can't believe. You can't feel it. You're numb. You can't feel it. I never say that. I never dismiss the patient about what they're going through, how are they feeling, any of that stuff. I always believe the patient. If the patient tells me that they're feeling cold on a tooth that we did a root canal on, even though I know for a fact that I've gotten every bit and piece of anatomy, addressed every canal, I believe the patient. If the patient during treatment tells me that they're feeling it, they're feeling pain while I'm working on the tooth, I don't dismiss them. I trust them, I believe them, I stop and I give them more local anesthetic. So what do I do in these cases? In these cases, I do cold test. I do cold test on the tooth that I've done a root canal on. Of course, I'm going to go ahead and take x-rays again. If I have to take a CBCT, I will take a CBCT. But again, multiple angulation x-rays and then cold test the tooth. But there's a trick. Now the trick is I spray the cotton pellet with endo ice in front of the patient so patient can see it. Patient can see that I'm spraying from the canister, from the endo ice canister onto a cotton pellet. And the liquid nitrogen is dripping from the cotton pellet in front of the patient. So patient can hear it, patient can see it. And I touch the cold to an adjacent tooth. Actually, preferably a tooth on the opposite side of the arch, equivalent to that tooth, but on the opposite side. Let's say I did a root canal on tooth number 2. A few days ago, I cold test a tooth number 15. I check, make sure it hasn't had a root canal before. I cold test tooth number 15, which is equivalent to this tooth on the upper left side, though. All right. Now, patient would likely raise their hand, indicating that they're feeling the cold, and that's normal. Now, I'm comparing the cold sensation from tooth number 15 to the tooth in question, right? Okay. Now, they saw me spray on the cotton pellet with endo ice. They heard me spray on the cotton pellet with endo ice, right? And I tested tooth number 15. Now, behind their back where they can't see it, I give the patient the impression that I'm spraying on the cotton pellets with the endo ice again, but I'm not. I'm just making the canister make that noise, but I'm spraying the air, not on the cotton pellet. So the cotton pellet is not cold. There's nothing on the cotton pellet. But patient heard me spray on the cotton pellet. So they're assuming, because they saw it when I sprayed on the cotton pellet, they saw me spray on the cotton pellet and test tooth number 15. Now they're hearing it. They're hearing the sound of me spraying on the cotton pellet, and they're under the assumption that I'm spraying on the cotton pellet, and the cotton pellet will be extremely cold. Now I touch that cotton pellet that does not have anything on it to the tooth. If they jump out of the chair or they raise their hand and tell me that they're feeling the cold, then I know that it's just in their head. I know that and I then tell them, I then show them, I say, look, I didn't spray, this is just in your head. Now what I do is, now that I've proven to the patient that this is not the tooth that is cold sensitive, now I will go back and touch something cold to the tooth. Very likely patient will not raise their hand. And then I start testing the adjacent teeth and even maybe the lower teeth, because sometimes you have referred pain. So I cold test the other teeth and take x-rays of the adjacent teeth and the lower teeth just to make sure that they're okay. So this is how I do it. This is how I do it. There's a trick. This is a trick that I have up my sleeve and I use it all the time. And it works for me. So hopefully it'll work for you too. But definitely believe your patients. Don't dismiss them. Believe them. If they tell you something, believe them. Investigate, but believe them.